suffered from a sprain of the ankle or a ligament injury in the knee or from a sore shoulder after a sporting event, let's say football or basketball, or after a casual slip in the washroom or while climbing down the stairs, your doctor would have told you have a sore ligament, and after a few weeks that take care by itself. But still, a lot many more suffer from some sort of chronic numbing pain in these joints because you know why? The ligaments have not really healed. That's because you have failed not to do some things in the initial phase. Let's take the prototype knee joint first. The knee is a joint with a unidirectional motion, moving on one side. Surrounding the knee, there are a group of ligaments which keep the knee from moving the same way. If these ligaments get injured, there is something called the RICE protocol, R for rest. Whenever an injury happens, you have to give rest to the joint and the ligaments for some time. ICE for ice. Ice application is known to reduce the inflammation there and help a lot. C for compression. Compression means applying a crepe bandage or some sort of support and giving some sort of a splint, either a plaster of Paris or either giving some sort of a commercial Velcro splint. And E is for elevation. All of us know if you have an injury, you keep a couple of pillows and keep the limb supported on top, and that's RICE protocol. This has to be adequately done immediately after the injury and also for a long time thereafter, let's say for a few weeks. Otherwise, these injuries do not heal and you suffer from chronic, long-standing, nagging pains which is troublesome for you. Let's take this to a more personal level, shall we? During my tenure as an MCH orthopedic candidate in Scotland, I used to love to go on mountain riding, especially on the icy streets. Accidentally once I fell down and I suffered from a grade 2 ankle sprain myself. And yes, my orthopedic boss himself put me on a splint and did not allow me to come to the hospital for a week. And then another further 2 weeks of rest and 4 weeks of avoiding sports. Now touchwood, 4 years down the lane, I'm feeling absolutely fine. Thanks to that initial period of rest and splinting, it made a difference for me too. So that's why in ligament injuries, the early rest is very important. And you can have injuries more than the ligaments itself. Your cartilage, the smooth layer I spoke of, that can have small cracks which can be disastrous for the future. Osteoarthritis, the damage to the joint can happen at an early age if people have suffered from cartilage injuries at a younger age. And 2, you can also have small cracks in the bone which is called hairline fractures, for which again a plaster or a splint is essential initially to keep it well rested. So don't take any injury lightly, that's the bottom line. A small sports injury or a just small slip and fall, it doesn't matter. Go to your doctor, get it treated well, follow the RICE protocol, take enough rest. If it doesn't happen, you may end up under the knife called arthroscopy, a technique wherein we make 3mm holes in the joint, go inside and we have to repair the ligaments. Yes, the success rate is pretty good. 3 months down the lane, you can do all sorts of sports activities. So take care of your joints, take care of your ligaments, rest well, exercise and live a good life.